All right, party people, we are back at it with some immunosuppressive drugs. Let's get it. So we have a 40-something male after having gone through a lung transplant. He notices increased thirst, increased urine, as well as his glucose being 140. His BMI is 21, blood pressure is 125/85. His creatinine is 2. He has normal gums, normal dentition, as well as normal hair growth. And I ask you, what med is he on? So let's run through this and not get too excited. So first and foremost, his increased thirst, as well as increased urine, as well as that blood glucose level of 140 indicates diabetes. There are drugs that can induce diabetes, and you will have to know some of them to be able to answer this question correctly. Also, please note that his creatinine of 2 is extremely elevated. Your creatinine should be 1. At 2.0, he's lost about 90% of his kidney function. Now, the mentioning of normal gums, teeth, and normal hair growth, this is a clue to you that cyclosporine is not the offending agent, because those are known side effects for cyclosporine. Now, can you have a patient on cyclosporine that does not suffer from the side effects? Of course, but this question is trying to help you exclude that drug from the differential. Also, please note that cyclosporine can induce hypertension. Now, this patient is normotensive. That also helps us move away from the idea that this patient is taking cyclosporine. Please note that both cyclosporine and tacrolimus can cause nephrotoxicity as well as induce diabetes. Now, it's worth noting that sirolimus does not cause diabetes. It is also not nephrotoxic. So, on the balance of probabilities as to what this patient is taking between sirolimus, tacrolimus, and cyclosporine, based on the fact that this particular patient has increased thirst, increased urine, increased glucose, we're going to diagnose him with drug-induced diabetes, as well as impaired renal function as indicated by his creatinine of 2. We're going to assume that the patient is on tacrolimus. This will also be confirmed by the absence of gingival hyperplasia, as well as the absence of hypertrichosis, which is the excessive growth of hair. But when you are given the option choices, there's no direct drug options there. And now we have to find and be able to connect the mechanism of action for these various drugs in terms of what is being presented here. Which ones bind FK506, which one binds mTOR, which one increases or reduces interleukin-2 transcription, and which one increases or reduces interleukin-2 responsiveness. Please keep in mind that these are all immunosuppressive agents. So any up arrow for IL-2 will be incorrect because we're not trying to induce rejection, we're trying to stop it. Now, it's important to note that cyclosporin binds cyclophilin. This is easy to kind of connect because they both kind of sound the same. That's an easy way to remember that. Now, you have to know that tacrolimus binds FK506 and sirolimus binds mTOR. So in this patient's case, we're going to be looking at, for tacrolimus, we will be looking at a positive binding of FK506, a negative binding to mTOR, a negative effect on IL-2 transcription, no responsiveness change for IL-2. Now, if the patient was on sirolimus, you have to know that sirolimus binds mTOR, therefore it'll be mTOR positive, FK506 negative. It will have no change on interleukin-2 transcription, but it will decrease IL-2 responsiveness. The entire basis of this question is trying to spell out to you that this patient is immunocompromised based on his lung transplant. He has to be put on a drug to stop autoimmune reaction of the host immune system attacking his transplanted tissue. So let's do a little review of all three of these because I know it can be a little confusing. All right, starting with cyclosporin, this binds cyclophilin. Tacrolimus binds FK506. Both of these decrease intracellular calcineurin. They also both decrease transcription of IL-2. In contrast, sirolimus binds mTOR. It does not decrease intracellular calcineurin. It decreases responsiveness to IL-2. Now, both tacrolimus and sirolimus you would think go together, but in reality, it's cyclosporine and tacrolimus that are more similar. Now, also, in terms of side effects, important to note that both tacrolimus and cyclosporine are nephrotoxic and can induce diabetes. In opposition, sirolimus is not nephrotoxic and does not cause diabetes. All right? Now, also, in closing, please remember that cyclosporine can cause increased hair growth, that's hypertrichosis, hypertension, as well as gingival hyperplasia. These are buzzwords and key indications that you have to know for your licensing exam. All right, that's going to be it for this one. Go crush it.